Welcome back to Let's Talk Patient Blood Management. I'm MaryAnn, and I'm here with Sarah again.
Hi, everyone.
Hey, Sarah, boy, what a drive we had today, right?
Oh, it was so nice. So gorgeous.
Oh, definitely, through the winding, beautiful Pocono Mountains. But worth it because we're here with Sherri Ozawa. And Sherri Ozawa is just an extraordinary leader in patient blood management. She lectures nationally and quite often internationally on patient blood management, bloodless medicine, and even implementation of PBM.
Yeah, just a global mentor for us nurses. We all want to impact patient blood management, not just in our hospitals, but to have a global impact is amazing.
Oh, I'm glad that you said that because she's been a mentor to many of us, not only as a content expert in PBM, but just speaking and writing, and she's just wonderful. Such a sweetheart. And I recently learned that Sherri plays the cello. I love that.
Mm.
Maybe we'll get her to play today. We'll see. But we're happy to be here because Sherri's just always on the move. You never know where in the world she is, right?
Hard to catch up with her.
But we're grateful to be with her in her home today here. And she is going to talk about what's happening globally in patient blood management. So let's get right to it.
Thank you, ladies, and thank you for having me. It's an honor to be an early victim of your podcast.
Yes, for sure.
Yes, thank you for the kind introduction. I am what I call the dinosaur in patient blood management. Sometimes we say hematosaurus for fun, but been around a long time. And so really spent the first 20 plus years of my career at Englewood Hospital, Englewood Health in northern New Jersey, implementing and organized first bloodless medicine and then very quickly expanded, as we all have, into patient blood management program. Because we really realized that was the right thing to do for all patients, really, as a standard of care. And then, of course, as you already mentioned, and we'll talk more about it, in 2000 was a founding member of the Society for the Advancement of Patient Blood Management. So continue active in that role. I've been very honored to be part of a number of global projects as patient blood management gets more global recognition because of the
Right.
impact it has for patients. And I'm also currently the director of delivery and operations for Acumen, which is a company that helps implement patient blood management programs across the United States. So a few hundred hospitals
Wow.
working
Wow.
with right now.
Yeah, congratulations on that.
Thank you.
So, in the words of Sherri Ozawa, why should blood be considered the body's liquid organ?
So it's sort of an interesting conceptual idea, the way that we think of blood. And we, in the medical field, often think of blood as, at least when it came to transfusion, people treat it maybe as a therapy, a medicine, an IV fluid, but very rarely, if ever, did we really think of it as an organ. But just as other organs have emerged recently in recognition in the scientific or medical community, like the mesentery and the interstitium, right? Things that were
Right.
sort of in front of us all the time. Why should we not think of blood or maybe the hematopoietic system altogether? We're not really fully sure how to fully define this, but the thinking is emerging. There's some work that says, really, is it the red blood cells that are the organ? And really, there's a whole organ system, just like there are other organ systems. But recognizing blood or approaching blood or the hematopoietic system as its own organ makes us, whether we're lay public or medical professionals, really think about it very differently.
Right. I know when I first heard the term of blood being an organ, you really don't think about replacing that organ
Right.
often.
Right. And if we look at it the same way we look at other organ systems or other organs, it really, for me, clarifies it in my mind, right? When we have friends, family, patients who have kidney failure, for example, right? It doesn't go from detecting kidney failure to immediately replacing the kidney. We do all kinds of things, right? Dietary changes and medication changes and maybe dialysis or 100 other things. And then when those have ceased to be effective, only then do we think, if it's available, let's replace that organ, because, right, a donated organ is so rare and such a precious gift, often given in a horrific circumstance, not always, right? But so Do we do the same with blood in our minds? Do we do everything else? And when those are effective, and for patients for whom it's an option or acceptable, then and only then think of replacing that organ with a transfusion. And if we did, it would, to me, very much clarify a lot of the things we talk about all the time in patient blood management.
Yes.
Can you talk about the concept of blood health a little bit?
I'm sure. And it's a term that we are starting to use more. And even, and we'll talk, I guess, in a little bit about the World Health Organization effort in PBM, which we'll call patient blood management for short, and save some time and words on the podcast. But that term blood health is actually being called sort of the destination, and patient blood management is the destination. And I really like that term blood health because it does align, again, as we said a minute ago, with other organ system conversations, right? And I love the term because it also inherently involves the patient as well. So, for example, if we say to a patient or any of us, take care of your heart health, right? Does it mean something to them? It does, right? You might say, I better get out of this chair and go exercise, or I better watch what in the world I'm eating. But it also means something to the clinician. How's the patient's heart health? So that clinician may think at a different level or a deeper level about it, but the same is true with gut health or brain health, right? You say, keep your brain healthy. Oh, I better go do some Sudoku, right? But the neurologist may think something different. So similarly with blood health, I think it really sort of captures that there's a role for
and it gives you a focus.
Yeah, I'm impressed by that too, because it shows us that the patients play a role, and it's so important.
And we really want them to feel that way, and that has been a struggle, I think, in patient blood management to this point, because we say it's patient-centered, but where really is the patient's responsibility? Where is the patient's voice in this? And I think that using that term blood health makes it quite accessible, and I think it paves the way for increased patient understanding and education for everyone.
Yes.
The term patient blood management, would you like to talk about when did it become patient blood management instead of just blood management, and why?
Right. So without getting too much into history, because we could be here for like 3 days.
It's another whole podcast.
20 years.
You guys have to move on to the next victim. So, so when we first started our society, SABM, Society for the Advancement of Patient Blood Management, we really struggled with how to capture what we were talking about. That we wanted to talk about what happens at the bedside with the patient, how people make decisions, both the patient making decisions and we as clinicians making decisions. So really the original name, even for the society that we came up with, was the Society for the Advancement of Blood Management in Medicine and Surgery, to try to say it's not what happens in the blood bank. It's not transfusion medicine. That's very important. There are really smart people who do that, but that's not what this is.
Right.
But that term blood management got picked up probably in the early 2000s by lots of people, lots of organizations, with no malice intended by any means. But it very quickly started to be used in the literature to mean inventory management in a blood bank.
Right.
How did people order? How did people process? And transfusion safety. And again, that's very important. There are really tremendously dedicated people who do that, and it's no disrespect to any of those folks, but we were trying to talk about what was happening to the patient. So thanks to our good friend and colleague, and probably the closest thing to a Nobel recipient worthy person that I've ever spent time with, Dr. James Isbister, of course, down in Australia, came up around 2006, 2007 with the term patient blood management, to try to say this was about the patient's blood. And again, maybe not the perfect term, but it's become, to me, the perfect term, to all of us, the perfect term.
Yeah, it really makes a clear distinction between that inventory process and caring for the patient. I think that's really important.
Yeah, and I think a secondary thing that needed to be clarified was not only the term patient blood management, but then the definition. Because that's another thing that we've seen in literature that has been defined multiple ways. And I know, Sherri, you were involved in helping to create the global definition.
Right.
Can we talk about how that came about a little bit?
Sure. So, we, and when I say we, it was a number of organizations that collaborated together. Of course, SABM, as we refer to, also the International Foundation for patient blood management. NATA, our friends in Europe, the Network for the Advancement of Patient Blood Management, Hemostasis and Thrombosis, a lot of long words, long
Right.
acronyms. The Western Australia Patient Blood Management Group, and the ONTRAC, who are the Ontario Nurse Transfusion Coordinators, Canadian group, collaborated together. And the reason that we felt that really putting in writing and then subsequently in publication a global definition was, to your point, Sarah, lots of definitions were out there. Even some of our early definitions in SABM and other organizations, we didn't even know we were doing it to ourselves, but they were very transfusion-centered definitions.
Okay.
Right? The earliest definition of patient blood management by SABM was really about the provision and use of blood components, right? And other definitions still exist, multiple definitions around the world. One from another very large society says that patient blood management is for patients who might need a transfusion, right? So we really felt that getting as many individuals and organizations aligned to a global universal definition, like so many things in medicine, take
Right.
a migration, we have to decide and agree on what it is we're talking about.
And have you seen forward movement and progress in kind of, or better clarity?
I think so, and I'm just going to read the definition.
Yes, please do.
Because I
Yes.
think it's important just to go on the
Absolutely.
record. So, patient blood management is a patient-centered, systematic, evidence-based approach to improve patient outcomes by managing and preserving a patient's own blood while promoting patient safety and empowerment. So, really, to us, this really captured the essence of what we were trying to do with focusing, again, on the patient's own blood as the body's liquid organ. And keeping that element of patient safety and empowerment in it. And really the definition of patient or person-centered care as we use it means patients' values and preferences are part of everything that we do.
Right.
And so we're excited that, 25 plus medical societies, the Malaysian Society of PBM and the Asian Society of PBM and many others around the world have endorsed this definition. The Society of Thoracic Surgeons here in the United States, the American Society of Anesthesiologists, a large number and a growing number have endorsed this definition. And that's really important because every time somebody mentions it in the literature, right, all these manuscripts, as we see, start with, this is what we're talking about. And they almost always start with a definition, like any scientific subject matter. So the more that we can have organizations endorse this and accept it, we think it keeps that focus on the patient where it belongs.
Absolutely. Similarly, I think to the World Health Organization, they also are promoting the global definition of patient blood management. We know in 2021, they drafted policy brief, an urgent call for patient blood management to be implemented.
Right.
And you were in part of meeting with the World Health Organization, right? And kind of bringing this to their attention.
Right. So it's interesting, and not to get, again, overly historical, but the World Health Organization first put in their official communication back in 2011 a reference to patient blood management. But in subsequent publications, it was always framed as an answer to transfusion availability. So as we might expect, the World Health Organization does have lots of content in how much blood, who's getting it, what is the situation in different parts of the world for transfusion and blood donors and all of those kinds of issues. And often patient blood management, again, was mentioned as part of that, but we really wanted to break away from that to say that those things are important. There are smart people to deal with that, but this is really not about that. So there are millions, if not billions, of people who can benefit immediately from better patient blood management, where if we talk about people that are even clinically indicated to receive a transfusion, it's a much smaller number. It's a fraction of that. So not that that's not important, but really do we get the most benefit, both economically, from a productivity perspective, from a clinical perspective, so many levels, is by paying attention to the patient's own blood. So we're really happy and grateful that the WHO recognized that this really had to be carved out as something that is not really connected to directly with creating more blood donors or more blood availability. So they did release that policy brief. I was privileged to be part of the creation of that. And then the next steps are actually creating some implementation guidance so countries really know what to do with that
Right, right.
recommendation.
Yeah, that's really interesting. I'm really looking forward to seeing what exactly that entails.
I know when I read that policy brief, I was a little taken back by the sheer numbers. 2.9
Billion.
billion people suffer from anemia, and it is really a suffering because of their decrease in their quality of life. Another 600 million with coagulopathy.
Yep.
And when you put that on the scope of many health concerns that we know very much and we talk a lot about, such as diabetes, affects 10%. So
Right.
that starts giving you sort of a picture,
Perspective.
a perspective of really how many people are affected by anemia and need this global implementation, and why the policy brief came out in their focus.
For sure. And a lot of the discussion, even more recently, as we're looking into developing implementation, is addressing what we call health equity, right? When I started, we didn't even have good terms for
Right.
this. So disparity and inclusiveness and health equity. But really, we know, and the data tells us definitively, that anemia and iron deficiency disproportionately affects women.
Yes.
Right? For a lot of reasons, including taboos around menstrual bleeding and just an acceptance that women of childbearing age are just tired.
Right.
And that's sort of an innocent bystander. Right. And then, but there's good data, as we know, that tells us that when women of childbearing age, particularly iron deficient and anemic, it affects those babies, right? And in subsequent pregnancies, every single one of those pregnancies impacts mom's iron levels.
Right.
And so when I give talks, as I'm sure the two of you do, to groups of clinicians or lay public, I almost always start with how many of you yourselves have been told you're anemic. And almost always, almost every woman in the room raises her hand.
Raises their
And some
hand.
men too, certainly.
Right.
And that's usually in a developed nation, right? But I see no different when I give talks in less affluent countries, lower middle income countries. So there's this disproportionate effect on women and children. And what does that mean, right? Women are the drivers in an energy perspective of households around the world, the economic drivers. So when that woman with multiple pregnancies or heavy menstrual bleeding or any number of reasons is anemic and we don't deal with that over the course of years, what is the impact of that productivity on a family, on a community, on a country?
Sure.
Right? We're talking about billions and billions and billions of dollars.
Right.
So where, again, the WHO can spend time talking about availability of blood, really, in terms of massive benefit across the world, paying attention to iron deficiency anemia has multiples of an effect.
Now, I did see on social media that you were jet setting to Western Australia,
I was.
and that was not a vacation.
It was not. I didn't even get to spend one day sightseeing.
It
for
was
me.
It was really the fulfillment of the promise in the policy brief that there was going to be more from the World Health Organization.
Right.
So can you tell me what you were doing in Western Australia?
Well, not sightseeing, but so like many things, right? A policy brief at a high level, or sometimes guidance from government. This is not government, but big agencies tells people what to do. It doesn't necessarily tell them how to do it. So we think the policy brief was a huge milestone in PBM. However, what does that mean? When we convince people, and you can read it, and it says, as you said, Sarah, almost 3 billion people around the world are anemic. Well, the call to action in that policy brief was to ministries of health and departments of health, or whatever it might be called in a country, to do something about that. But what can you do about that? What you can do in the Poconos or in the United States,
Right.
where we all think we're resource constrained no matter where we are in healthcare,
right.
and we are.
Right.
But we have available to us multiple kinds of intravenous iron, and we have oral iron, and we have patient education information. We have all these different things. There are parts of the world where they may have nothing except an iron cooking pot,
Right.
right? Or I've visited countries where they take an apple and they hammer nails into it and then let it sit and then let people eat
Get
the
some
apple.
I've never
iron.
heard of
Yeah.
that one. That's a good one.
Right. So, but even if all that someone has in a particular area from a clinical perspective is eyes and ears and hands to listen to and to touch and to examine a patient, that's not nothing. That's
Right.
something.
Right.
So the goal of the meeting that we had in Western Australia, to start to create some of that implementation guidance, particularly for low and middle income countries, so that even if you don't have as many resources as another place, you do have something. And how do we get some education to those clinicians, all of those clinicians, to make them realize that they can do something to address this?
Wow. So anything that you felt you really had forward movement on?
Yes, we had really a lot of discussion about education, and how do you deliver that, right? Not everybody, SABM has a great certificate course. It's fantastic. Not everybody's going to be able to access that, either from a
Exactly.
time perspective, a financial perspective, a resource perspective. There's other exciting moves afoot around the world. The University of Western Australia itself is creating some graduate level education in patient blood management. That's fantastic. But again, different things for different environments. So we really talked about creating sort of small doses, small bites of education for places that where folks are not going to be able to necessarily access what we might be able to. Just even if we get 4 or 5 points across about what patient blood management, pay attention to anemia detected.
Right.
Here's 2 things you can do about it. That's something. And then the other large conversation was really around what metrics do we use, right? We're not going to be able to travel to 150 something member states and examine every single hospital and every Ministry of Health to see how people are implementing patient blood management. But there are some existing metrics, for example, that are reported. For instance, you can go onto the World Health Organization website and see anemia prevalence in all of their member states in women of childbearing age. I didn't know that existed.
No.
But we talked about something similar and what kind of metric do we use, right? Something simple. We can't ask people, particularly in under-resourced areas, to measure 10,000 different metrics. They might have
Right.
they don't have electronic health records. And even those of us that do struggle sometimes to get the information we want out of those records.
For sure.
So we talked about maybe what metrics we could use that everybody could report on that would tell us something about their implementation.
Wow. Well, thank you for that great work. It's just so neat to see you advance this, beyond the United States. What countries are really making forward strides?
Yeah, and it's a great question, Sarah. Thank you. And it's really interesting because there's countries that we wouldn't immediately think of, right? So we're an all-American at this table, right? So we immediately think of our successful,
Ours is
and
the
you
best.
ladies have fantastic patient blood management programs that you've built. But the U.S. healthcare system is, the more you travel, the more you realize how different it really is, how we think and do things very differently here. That's not a bad thing. Sometimes it is in terms of healthcare, in terms of expenditure, right? But
Yeah.
that's a subject for a different podcast. But it's been quite amazing in different parts of the world that, countries that are even lower middle income. And there are certainly countries that are called on paper middle income, but they aren't that middle. They're pretty low income.
Low.
So to briefly answer your question, which is always a challenge for me, at the top of my list and very near and dear to my heart is Turkey, where they have had a national initiative and have really educated thousands of physicians and nurses. Nurses have a pretty elevated role. It's pretty similar to the United States. Nursing education is excellent, as is medical education in Turkey.
Right.
So they've done amazing things in implementing patient blood management. Right now, there's a tremendously exciting project, more than a project, initiative going on in Russia.
Really?
And in Mexico, particularly, even more so, where there's thousands of doctors lining up for education and some really interesting software that's able to measure outcomes related to PBM implementation and maturity of PBM programs. Spain is doing some excellent work. Portugal's doing excellent work. There's some national mandates, and we're learning a little bit about how those work and those don't. And it's not a criticism of any country, but Italy is an example where there's been a national mandate and there's great clinicians. But again, often it's the how do you do it, right? It's one
Right.
thing to have a mandate to say, everybody now needs to go do patient blood management. Well, what do we do?
How do
What
we
do
carry
that
this out?
information?
Yeah.
Right. So Brazil has some exciting things going on. Certainly the Canadians continue with their on track work, foundation laid by that. So those are just a few of the hot ones on my list. It's really exciting to see the progress around the world.
Oh, this has been just fantastic. And I keep thinking of so many different things. But thank you for sharing mostly about the state of patient blood management in different countries, different locations across the world. So, what do you think you'd like to leave our listeners with? Like, what key takeaway do you think you'd like for people to have? about patient blood management, maybe where it's going in the future?
I think that it really is migrating. It's exciting. I don't know if we're quite at a Gladwellian tipping point. I'd like to think we are. Sometimes there's days I feel like we're there, and there's days I feel like, oh, nobody knows what we're talking about. One thing without getting too deep into it, I think we are kind of following the infection prevention model. That's the one I use as the closest simile, where, right, a number of
Sure.
years ago, people figured out that, right, we needed to do something to prevent infection. We used to call it infection control
Right.
in hospitals. And then it was a little loose, but it became tighter and tighter. And then these different elements came into it, like antimicrobial stewardship and hand washing. And then we started to decide what we had to measure, like CLABSIs and CAUDIs and surgical site infections. Like,
Right.
we really figured out what those metrics were. And what do we say about infection prevention? Everyone's a stakeholder. Patients are,
Right,
clinicians
right.
are, right? Maintenance people are. Everybody who's anywhere near, right, the patient or the healthcare
Right.
system is a
Is
stakeholder.
responsible.
So, and what ended up happening too, right? Nobody would think, a hospital would never think to say, we don't need an infection prevention department.
Right.
We have it. We have to have it,
Right.
right? Because we want to keep patients safe, but there are measures that we have to fill.
Right.
So I hope we're on a similar pathway. I see the role of nursing in a similar way, the way it has emerged as the leaders, nurses almost always. And many
Yeah.
times advanced practice nurses are the leaders in infection prevention in hospitals. I think that in many cases, along with administrative colleagues, but nurses are
Yep.
emerging, particularly as anemia management folks, where most of our hemonc colleagues, physicians, are mostly oncologists, a little
Right,
less in the hematologies. They call benign hematologies and all that benign. But we see more and more a role of nursing emerging. I think that that's kind of the path we're on. I want to see the day where, certainly in the United States where we are, but really around the world, that nobody would say, well, we don't need patient blood management people or a program here, just the
Right.
way we would never say that about infection prevention.
Oh, yeah.
That's such a
It's a
great
great
point.
parallel. Yeah.
So that's the one I try to use. And then I think we need to figure out what those measures are. I don't think we're there yet. But somebody somehow translated the fact that when a CLABSI happens in a hospital, it means, right, X dollars, X effect on patient outcomes. And it impacts reimbursement and affects
Right.
quality ratings, right?
Right.
All these things. So what happens? We stop. If there's a series of CLABSIs or CAUDIs or surgicals, the whole place stops.
We have to research why.
Right.
all
What's
kinds
going
of root
on.
cause analyses, and we just figure it out, right? I want to see the same thing in PBM.
Oh, yeah, absolutely. It's a great
That's
point.
a wonderful goal and drive to get to. And there's a lot of work still. So,
A lot of work. We'll have jobs for a while.
yes, yes, we will.
Definitely. Definitely.
Thank you so much for this conversation. We hope that we can have future conversations with you if we can
Anytime.
catch up with you in your global
Right.
travels.
Anytime. You're welcome to come. Please join.
Thank you so much, Sherri.
Thank you for having me.
Yep.
So exciting.
Yes, it was.
The excitement, it just doesn't stop here today, right? So much
No,
coming
not
up.
for our listeners.
We're stoked. We'll be launching our special 3-part mini-series here
Yes.
on Let's Talk PBM. And
Yes.
the topic of this mini-series will be on the much anticipated release of the book, Bloodworks, an Owner's Guide. And throughout this mini-series, we'll be talking to some of the authors of the book, Bloodworks. The first episode is going to be titled, What Every Person Needs to Know Before They Are a Patient.
Mm-hmm.
And can we say who it's going to be?
You know what? Let's just create a little mystery. I'll include a little sound clip here and see if you know who our
Fair
next
enough.
guest is going to be.
The book as a whole has a key message. The one issue we've missed in medicine for years is recognizing that blood regenerates. And if that's one message after reading all the short stories you come away from, I think that we've done our job.
So wonderful. So before this mini-series is published on the site, that book will be available to the listeners. So I'm just going to repeat the title of that again. It's called Bloodworks, an Owner's Guide. And Sarah, can you tell us a little bit about where people can get this book?
Yeah, so it's going to be available on all major platforms. However, here's a little tip for our Let's Talk Patient Blood Management listeners. We love to see and help these kinds of awareness initiatives on advancing patient blood management all around the world. And so if you want to support an awesome cause and get a much better price, go directly to the publisher's website. The website is www.bloodworksbook.com. I'll put the link in our episode summary. It's going to be available here in the next week or so. By buying this book through their website, we'll be going to help global anemia initiatives worldwide. So instead of your money going to some corporate pocket, you're going to really be making an impact and a difference. And so that's where I'm going to get my book.
If you have any questions from today's show, we love getting your emails and comments at letstalkpbm@gmail.com. That's letstalkpbm@gmail.com.